Welcome to our today's presentation. We'll be dealing with high yield topics in Obs and Gynae, Obstetrics and Gynecology. So if you really want to pass your GMDC, you must familiarize yourself with these topics, All right, so if you're new here, you might want to subscribe to this channel for more of these things. Let's begin. All right, so for obstetrics, so anytime we talk about obstetrics, we're dealing with things that have to do with pregnancy, things that have to do with pregnancy. So anything with pregnancy, those are what obstetrics. And anything that does not involve pregnancies, that aspect is what ops. Sorry, those aspect is gynecology or gynae. All right. So basically, under obstetrics, you might want to get to know more about antenatal clinic, normal and abnormal labor, induction of labor, preterm labor, normal and abnormal puerperium, hyperemesis gravidarum, that is, how do you call it? Vomiting in pregnancy, basically. Then bleeding in early pregnancy, antepartum hemorrhage. So maybe bleeding in pregnancy, antepartum hemorrhages, very, very important things that you need to know. When they occur at this time, what are you thinking about? What differential are you looking out for? All of these things are topics you need to know. Then the postpartum hemorrhage, you need to know all of these things. Then we can also talk about hypertension in pregnancy, abortion, ectopic pregnancy, molar pregnancy, breech presentation, multiple pregnancy. These are things you have to know. We have premature rupture of the membrane, A lot of these things, you have to know them. Then fetal distress, malaria in pregnancy, What do you do? Because pregnancy is very, very, very common. So what do you do when a person is pregnant? Very, very important. All right. Then UTI in pregnancy, urinary tract infection in pregnancy. You need to know a lot of it. And then sickle cell disease in pregnancy. Now, sickle cell is a topic that you must know. You must know everything about sickle cell. If you really want to pass your GMDC licensure exams, you have to know it. All right. Now we are still on it. HIV in pregnancy is also there. We have gestational diabetes mellitus. We have cerclage. So those people with, let me say, incompetent cervix, or it's very loose, you have to do this procedure to tighten it, or you have to suture the cervix to tighten it up. Otherwise, it can easily lead to abortion. So all of these things, you must know them. Then the MVA, that is the manual vacuum aspiration. You have to know what it is all about. Cesarean section, CS, cesarean section, you have to know about it. Then shoulder dystocia. This is one of the major causes of birth asphyxia and how do you call it? CP or cerebral palsy. This particular thing is one of the major causes of it. So you have to know about it as well. All right. Now let's move to the gynecological aspect. That means things that do not involve pregnancy, things or diseases that does not involve pregnancy. All right. So we have infertility and amenorrhea. We have STI, sexually transmitted infections. Then we have pelvic inflammatory disease, PID, pelvic inflammatory disease, fibrosis, endometriosis, dysmenorrhea. So those of you with, problems with menstruation, sometimes very, very painful, unbearing pain. So all of those things, we can describe them as dysmenorrhea. Then we also have a dysfunctional uterine bleeding, a dysfunctional uterine bleeding. Then we have the PCOS, or the polycystic ovarian syndrome. Polycystic ovarian syndrome. You have to know all of these. Menopause. Then we have contraception or contraceptives. If you don't want to get pregnant, these things you have to know them. Cervical conditions. Then we have endometrial conditions. We have ovarian cancers. We have female genital mutilation, FGM. We can talk about rape as well. Very important things that you must know. So basically, this brings us to the end of the high yield topics in obstetric and gynecology. We do classes, private one-on-one classes. If you want to be part of it, I will put a link in the description and you can join for you to be part of our private tutorials. We basically answer questions, high yield questions. So yeah, so for now, do it to share and like our video if you enjoyed it. Peace out.